Has the government made a damaging miscalculation in banning most unvaccinated care home workers from doing their jobs? From tomorrow morning, care home staff in England who are not double vaccinated against COVID, who are not exempt, will not be allowed to enter a care home. Neither can anyone else, for example, plumbers, catering or entertainers. The National Care Home Forum has calculated that providers could lose 8% of care staff, worsening an existing staffing crisis. So has the government created an unnecessary problem by using a sledgehammer to crack a nut? Or, as the England Health Secretary Sajid Javid has said, is it the government's duty to protect the most vulnerable in society from contracting COVID? We know that people who are vaccinated can still transmit the virus, so will excluding unvaccinated staff make a difference to COVID in care homes or not? Here's our health correspondent, Deb Cohen.
If, as a country, we're going to force care and health workers to be vaccinated, how clear are we that it will help tackle COVID by reducing transmission and stopping vulnerable people getting sick? Vaccines reduce the risk of getting infected in the first place, and if you're not infected, you're not going to pass on the virus. But that's not the full story.
It's actually quite difficult to be exact about what the reduction in transmission will be. If somebody gets infected and gets ill after vaccinating, they're slightly less likely to spread the infection to another family member, but not. But they're still doing that. They can still spread the infection, and trying to get the exact estimate of risk is quite difficult.
So, are we sure that by going ahead and making vaccines mandatory, it's going to mean more health and care workers get vaccinated?
It probably will encourage some people to take it if the reasons they're not taking it are that they're just a little bit unsure, or they've just not got around to it, or they don't like the sound of it. But we have to be sure that we've really tried everything else first. So we're essentially forcing people to choose between putting something into their bodies that they don't want or potentially losing their livelihoods. And that is quite a coercive measure.
And this brings us on to perhaps the biggest question, the moral one.
Any attempts to address vaccine hesitancy in a way that's less coercive requires time, it requires conversations, it requires a building of trust. One of the difficulties that we've got is that there are still quite a lot of scientific and factual uncertainties, and good ethics is founded on good facts and good science. So science can't tell us what we should do, but it gives decision makers a solid factual grounding upon which to make the good decision.
As a medical doctor, although I'm not practicing anymore, but if I was and I'd not had the vaccine, I think I have a moral responsibility to have the vaccine to protect my patients. But that is my view about myself, and I struggle to force other people to have a medical intervention that is against their will.
As with so many of the big questions during the pandemic, what are the benefits of the policy and what are the harms? To what extent will mandating vaccines bring measurable benefits? And ultimately, will it be worth it for a sector already struggling?
Deb Cohen. Well, joining me now is Vic Rayner, Chief Executive of the National Care Forum. Thank you very much for joining us. How do you think, as of tomorrow, this will impact day-to-day life in care homes?
I think it's going to make day-to-day life harder in care homes because it will exacerbate the existing staff shortages and challenges that organisations are facing. We know that there are significant staff vacancies in the care sector already, and our recent survey showed that organisations anticipate up to 8% of their staff leaving as a result of this. And, you know, staff are leaving for all sorts of different reasons. And having mandatory vaccination is going to make life incredibly difficult in a range of different care homes across the country.
So what kind of people come in and out of care homes every day? I'm not talking about care home staff now, I'm talking about other ancillary services and so forth.
Absolutely. So you're absolutely right. So the policy brings in a situation where all of those who cross the threshold into care homes have to be double vaccinated. So there are a huge, care homes are people's homes. So they are communities. They're where people live and they should be where people thrive. So lots of people come through the door pre-COVID. So we've got people who come in and provide personal services to individuals, so chiropody services, hairdressing services, manicures, all sorts of different things that people might have as part of their kind of daily life, people who come in and carry out entertainment functions, activities, ministers, people who come and provide faith-based services, people who are coming in order to carry out community activities, schools, school children, people who come in and volunteer. I mean, it's where people's home is. And so actually what this policy is doing is not just talking about staff vaccination, but about all those people needing to be vaccinated.
But particularly on care home workers, don't they have a moral duty to be vaccinated?
So I think this is one of the really, as your previous speaker said, one of the really challenging issues. But what care home managers will tell us is that the most effective way to address vaccination hesitancy, for whatever reason it is there for, is the time, the support, and giving people the opportunity to work this through for themselves. It shouldn't be forgotten that everybody working within a care home continues to be tested on a regular basis, continues to wear PPE, and continues to carry out infection prevention control measures. But I think the whole issue of using this mandatory approach is causing enormous problems for those care homes that are needing to provide care to people on a day-to-day basis, but particularly the shortages that this is bringing and that other shortages within the sector are showing is for those who need care in the future and the problems they're facing. So it really is something that you might talk about a moral issue about vaccination, but that we've also got a moral issue around those who need and require care right now being unable to access it because they're unable to come out of hospital because staff aren't available to enable people to be supported in the community, and they're unable to come out of the community and get respite care within care homes. And I think it's the fact that, the government wanted to introduce a mandatory vaccination policy. It's brought that through. It's been a chaotic and shambolic approach to policy implementation. It's been incredibly difficult on the ground to do it. But we know that from tomorrow, it will be the case in care homes, and it will be extended across the wider health and care sector over the coming months. It knew in its own impact assessment the impact that this would have on staffing numbers and will have on health and care staffing numbers. And yet it has done absolutely nothing to help care organisations to mitigate that. We've called repeatedly for additional funding, for a retention bonus for those staff who continue to work in the sector, and for an increase in salaries for those staff to recognise the skills and experience that they have. And I think that's what we need to be focusing on. How do we get a government that wants to introduce these policies, wants to mandate, wants to,
Vic, Rena, I'm afraid I'm going to thank you very much. I'm afraid I'm going to stop you there. Thank you very much indeed.